You're watching CNBC Africa, and this is another episode of Focus On. I'm Zanella Morrison. My next guest is Julie Gishiru, Chief Public Affairs and Communication.
Thank you so much. It's a great pleasure to be here, and please let me start by taking us a step back, if you would allow me, to the genesis of the organization. And so we are MasterCard Foundation and not MasterCard, and we are separate organizations. Now, we were born of MasterCard through a remarkable gift that they gave to the world in 2006, and it truly was a gift because they set up what is an independent foundation with its own board of directors under its own direction to go and change the world. A truly remarkable thing that took us into a space of education and financial inclusion for the first decade of the foundation. And then we sat back and asked, what is the thing we need to focus on to really make a difference in the world? And different stakeholders spoke to us, and we landed on Africa and young people. And we saw the unemployment crisis in Africa as an existential crisis for the world. And we identified this and said, look, we're going to dive into this. And we developed a mission and a strategy, Young Africa Works, 30 million young Africans in dignified work by 2030. And so this is where we come into the health space in Africa. It was really when COVID hit. And we realized that this was affecting economies. It was not just taking lives, which was just horrifying. It was also decimating economies, and therefore people were losing jobs. They couldn't feed their families, and we felt we needed to step up. We looked at the Africa Sea as the mandated institution for public health, safeguarding public health on the African continent, and said this is the right partner to work with. And so we embarked on saving lives and livelihoods.
And how critical that is, because if you think about who also have lost their lives, it's your older generation. So your young people are remaining, and we have a huge population of them coming into the economy year in on year and year out. So how do you work then with your various partners? Because as MasterCard Foundation, you are the fuel to someone like CDC, who now gives you tentacles into so many other things. Yes. How do you then draw the meaningful participation part for young people? Perhaps an example or two.
Okay, so there's so many lessons to learn, so you'll allow me just to dive in and just highlight the significant things we're seeing through the partnership, for instance, with the Africa CDC. The world is becoming far more complex, and we're realizing that you need different stakeholders at the table all pulling together to make a difference. When we partnered with the Africa CDC, they immediately then went to member states. And they said to member states of the African Union, what are your plans in your countries to safeguard your communities? What are the things we must do? And working with ministries of health, each of the countries were able to develop strategic plans. So first of all, alignment there. When you align with a government, you are able to build scale and really, truly drive impact. The second thing was identifying implementing partners at country, national, and regional level who were there, who have been there, who know the countries, they know the communities, and therefore can ramp up very, very fast. And so we went through a process of identifying a series of these partners to work with, and therefore we saw speed and scale in execution. Now coming to the young people, ultimately, we need qualified people across the health system. This is from your community health workers, who are so critical at community level. They are the first point of call for the vast majority of Africans, all the way up to your scientists. When you look at, for instance, vaccine manufacturing on the African continent, where are the scientists that are going to drive this? And the role of young people there. And so what we started to do was to train, equip, and deploy. So in the partnership Saving Lives and Livelihoods, for instance, 35,000 young people across the continent have been deployed within the health system to serve all the needs around the vaccination delivery, vaccines in arms, communication, etc. When you look at the vaccine manufacturing, working with the Institut Pasteur de Dakar, we are building an army of scientists who will be the ones who see the continent through when it comes to vaccine manufacturing. Young people, and ensuring that they have the skilling, the training, and are able to be deployed will be what stands the health security of this continent up. And we're so excited in some way to work with the critical partners who are making this happen.
And you're responding to healthcare where it's needed, not taking people to healthcare facilities. So social community healthcare. But then you also need the infrastructural development of hospitals, of the current facilities we have, because is the need, and how big is the need perhaps is the question. Are we also able to see those structures being given sanitation and water and making them just feasible to be healthcare facilities?
I think that's a great question. I think you're absolutely right. We've got to take health to the people and not expect them to come to the health. I think there's massive roles to play and different players that need to be in the rules. So governments, and we know a lot of governments do, hold up the health systems in many of our countries and their infrastructure, and there will be players who come in to support that. Our private sector is increasingly playing a role in health on the African continent and developing infrastructure, which is critical. I think we see our role in our niche in that space of training and skilling. We're also looking at how to develop systems around data collection and data management, which we believe is absolutely critical. So understanding where we can contribute and stand alongside those others who are coming to the table, I think that is what partnerships is about. It's about everybody bringing their expertise, their weight, a common purpose, a common agenda, but each person plugs in with their strengths and capabilities.
And I agree with you. Know your lane, choose it, and do really good in the lane that you're doing. But let's speak about funding. How do you see funding progressing over time, especially in education, because it's not just you, in infrastructure? Are you finding that this collaboration is being supported by adequate funding?
Yes, that's a great question. For the MasterCard Foundation, this was where we started. It was education, and it was really for the most underserved communities, the most vulnerable and marginalized. And we stayed consistent to this cause, just recently finding out that we are the biggest education funder in the developing world globally. But this was just step by step. It was just focusing and understanding that once you unlock the educational potential of individuals, you can track some of the impact, but the ripples are so significant that they are truly transformative. And so we double down, and we are in this space. We understand the importance. We welcome others to do the same. There is not enough funding, that would cover the needs. Even within Africa, talk less of globally, right? So bringing more people to the table around this agenda is something that would be absolutely incredible, but we are here. Part of what we are doing now is trying to look at how to strengthen and stand up African educational institutions when it comes to everything from curriculum to capacity of, even mental wellness and career development, abilities within these institutions to take in these young Africans who are brimming with energy, so much potential, and just really supercharge them for the future.
And you speaking of you also spoke about just the spectrum. We spoke about social enablement of healthcare workers, and now you're at the university, and then you're doing sciences. How easy is it to move across such a vast band? Because if you're looking at indigenous people and what is required there, and then you're moving all the way up that spectrum, what enables the MasterCard Foundation to keep on doubling down across a band this long?
Incredible partners. We couldn't do it. It's not us who do it. We stand by, we support, we enable partners who are in it, partners who know their communities, partners who are present on the ground, partners who know where their countries are going and how they want to get there. And therefore, this idea of how development positions itself to enable African institutions, indigenous institutions, local players, to do the things that need to be done, but also to direct and guide where we are all going. So development maybe comes from a history of bringing solutions to
being told
to the
what
continent,
to do.
right?
Yes.
Bringing solutions to the continent, bringing the solutions to communities who, because they have needs, take them patiently, get their capacity built, and then do the best they can. But what about reframing and saying, hey, we understand that you are the communities. You do have a vision for where you want to go. How do we help? What are your strengths and where are your gaps? What do you need more of? What do you need less of? And working with partners who are on the ground and in essence, parts of these communities are the ones that then are able to drive these significant shifts.
Is it a lens that you've seen shift broadly? The lens of this is what we believe Africa needs. It needs HIV and tuberculosis, and we are coming in, and these are the solutions, to put it simply. Or do you think that the lens of has opened up so that we can see that the continent has got very dynamic needs and the people know how to solve for them if you work with them? So besides just the MasterCard Foundation, I'm lifting you up and saying, give me a lens of, are we as the global world in healthcare starting to see how we need to fit in?
I would say we are at the start of a period of transition. So there's still a lot of discomfort with a new way of approaching things in many spaces. And then there are those who are boldly going forward and saying we need to do things differently. It hasn't quite worked for the past 3-4 decades. And how can we be innovative and truly ensure that lasting change happens for communities, right? And the change they want also is important. So when we came into Saving Lives and Livelihoods, we were so clear this was about COVID-19, protecting communities, safeguarding lives and livelihoods. And as the journey went on, we started to hear back from the Africa CDC, from implementing partners, from member states who said, this is great. We're protecting communities from COVID-19, but we have a raft of other issues. And this cold chain supply delivery, supply chains that you've developed can help for childhood immunizations. They can help with, a raft of other things. And can we integrate? And we looked back and said, yes.
Why not?
Absolutely. If this can strengthen the health systems, integrate. But there may have been a point where, and there may be some organizations that feel because they came in to do a certain thing, they must stay within the lane. However, as development, we have to continuously ask ourselves, what do we leave behind in terms of strengthening? It shouldn't all be to tick boxes for our own agendas. It should be to ask communities, what can we leave through our work that is truly transformative for you as well? I think that's the journey we have to make, and I think we're at the beginning of this shift, and it's exciting to start to see it happening.
I'm happy to be part of the journey, because next time we speak, we want to see how further along we've gone. But what's really interesting is that you're saving livelihoods. Saving livelihoods so that what can happen for the continent?
Ultimately, families can feed themselves. They can plan for their futures. They can have dignity. They can prosper. This continent, we all know, is an extremely rich continent. It's not just rich in resources. It is rich in culture. It is rich in the population size and the raft of young people we have on this continent who are so idealistic, hopeful for the future, and wanting to contribute, not wanting to leave. If they could stay, they would stay. If they can be allowed to thrive and prosper, this African continent would be a different place. So, livelihoods for all of that.
And in partnership with the CDC Africa, that was the MasterCard Foundation, talking about saving lives and saving livelihoods. Hope you've enjoyed this episode. I'll catch you in the next one.